Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? Story 1. We are taught to explain to patients exactly what we are doing. As we are doing it, delicate wording becomes important during female pelvic exams. Instead of, okay, I am going to place the speculum inside now, so you'll just feel some warm pressure, my buddy ended up saying, okay, I'm coming inside you now. The female patient responds, no thanks, I already have 3 children. Story 2. My granduncle is a urologist and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that so we can continue the examination. I had no idea what masturbation was and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it so we just sort of waited until it went away. I don't know if it was awkward for him but whenever I think about it I cringe myself into the fetal position until I can block it again. Story 3. So I'm a little bit late, but I have something. I'm not a doctor, but a pharmacy technician. About a year ago, a young woman comes in very upset and turns in a prescription for a bunch of anti-anxiety and antipsychosis medications. All is going well until I realize we are out of one of them and I have to tell her I have to order it for the next day. She was okay with it at first, but then I see tears building. I ask if she is okay and says yes, so I continue typing up the prescriptions. I want to say there was about 8 or 9. Next thing I know, she begins crying. She starts telling me that she was just released from a psych ward and she had tried to kill herself a couple weeks back. She rolled up her sleeves and her arms were covered in deep cuts. She began to ask me if I thought she would ever get reaccepted to nursing school because apparently they kick you out after getting admitted to a hospital for psychological symptoms. I had no idea what to tell her except that I hoped she got in and that if she worked hard they should give her a chance. I know this all may sound shallow, but I was not prepared for this. Nothing in pharmacy tech training told me how to react, so this was definitely my most awkward moment with the opposite sex. Story 4. I'm sick, I'm exhausted, I'm depressed and trying my 5th medication, and there's something wrong whether the prescription can't be filled or my insurance isn't covering it. Sometimes the pharmacy tech was just fine, patient, professional, told me kindly to come back if I needed to make some calls first. Sometimes the tech was rude/impatient. But there was this one tech who was awesome. She was explaining possible side effects of this antidepressant, Standard, and I was just about in tears because I was so tired of hearing it and she just looks at me and says, oh honey, this isn't the first one you've tried, is it? I really hope this works for you. You just keep trying. It'll be alright. And she smiled. Just that tiny bit of humanity made my week. Even if the young woman in your story didn't go back to school, it probably meant the world to her that a stranger of a pharmacy tech took the time to listen to her and said something kind. I apologize for leaving you a small essay here, but please don't consider your story shallow in any way. You listened to someone who was worried and hurting. You went above and beyond your job description. You might have saved a life. I've got tears in my eyes right now because someone did that for me. Internet hugs sent your way, kind stranger. X. Story 5. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman pillager of a man and gets to go first. He proceeds to insert his fingers to palpate for the bimanual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he's gonna need to use one finger for those procedures from now on. Story 6. One of my friends was getting a physical for a high school sport I believe, and when it came time for them to check his gonads, the doctor says, cough, but apparently my friend thought he said, hop. So here my friend is standing there, the doctor has my friend's boys in hand and my friend hops. Said it was the most embarrassing moment of his life. Story 7. Doctor here, recently walked in on a new mother in a sitz bath with 2 breasts pumps gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. Story 8. When you get a vasectomy you get your dick taped to your stomach. A nurse came in to do the finishing after the procedure. She was middle-aged, and I'm guessing she probably got into nursing late, because she was looking really nervous and uncomfortable, and anyone who's been in nursing more than a few years has had hands-on penis experience. She's kind of tentative and unsure about pulling the tape off, so I say, go ahead, it's been through a lot in its time. She got a big smile and ripped that shit off of there. So she's totally cool in my book. Story 9. Third year of medical school on my family medicine rotation which I'm doing on my med school's campus academic health center. Electronic medical record shows 24-year-old with chief complaint of cough, so I go in to interview her. Where it comes to light, she's really there for vaginal itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done OB/GYN at this point and was quite comfortable with it, but we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents, I do the pelvic, we write her a script for some antifungals and she goes home. 2 days later, I'm teaching a small group of first-year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation, when, during introductions, I come face to face with my patient who never mentioned she was a first-year student. We both play it off really cool at first, but during the session, her partner asks me to show him how to do an inguinal/femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter, which causes me to lose it and start laughing at the absurdity of the situation as well. She played it off like she was ticklish and I said something stupid like, "I thought of something funny, don't mind me." 2 weeks later, she returns to the clinic for a follow-up and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the shit for a bit when she goes, "So when are you going to take me out to dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. Story 10. My perspective may be off the scope of the thread since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. Story 11. Working in ED at a large hospital without any pediatrics or OB/GYN. Just about to finish night shift and I am asked by a nurse to quickly see an 18-year-old with abdominal pain. I was exhausted and didn't want to pick up another patient, but I just had a weird feeling. Went to see the patient. She was a thin girl lying in bed under the covers in the fetal position with her worried mum sitting nearby. I ran through a brief history and was about to examine when she stated she needed to go to the toilet. She looked to be in a lot of pain, so I asked for a nurse to escort her. At this point the patient, her mum and myself thought it was a burst appendix. Next thing I know, the nurse yanks me down the corridor and shoves me into the bathroom. Before me stands a thin 18-year-old girl bearing down in a squat with a now noticeable baby bump repeating, "Don't tell mum, don't tell mum, don't tell mum." I throw her in a nearby bed and charge into the recess area, leaving the mum unbeknownst in her cubicle. I grab my boss, who goes white and starts shouting, "Why is she here? Why is she here? And not the obstetric hospital?" We run back in, by which time she is fully dilated and pushing. We successfully deliver a beautiful baby boy while constantly freaking out about the lack of pediatric supplies. We didn't even have clips for umbilical cords, but we improvised. Throughout this time the girl is either pushing or begging us not to tell her mom, while we keep saying, "She drove you here. You can't hide a goddamn baby." The girl wanted to keep the baby and ultimately we convinced her to tell her mom. I told the mom her daughter was safe, but there was something I needed to show her. The look when I brought mom into the recess room was unlike anything I have ever seen, anger mixed with concern mixed with joy mixed with confusion. What dot crazy, fucking, day, that was. Story 12. Being a resident in Saudi Arabia, there's a huge stigma attached to male attendings examining female patients, especially those with gynecological issues. Also, being a foreigner residing here, some customs and practices catch me completely off guard at times. That being said, I was once in charge of my consultant's OPD during a OB/GYN rotation, said consultant having left early thinking all major cases and appointments had been dealt with, and left me to clean up any stragglers in the last hour. In walks a 40-ish-year-old mother with her 18-year-old daughter, both completely covered from head to toe in burqas, who then proceeds to throw a tantrum about how the consultant wasn't there for her appointment, and how she left a male resident in charge of the OPD. A cursory examination of the daughter's file didn't reveal any history, which would have helped me decide if my superior should get involved. I then began to try to talk her down, asking her what her appointment was about, and how I was in charge of the department. I didn't dare reveal I was just a lowly resident, and I would do everything in my power to help her out with any issues her daughter had been having. After a lengthy conversation I find out that the daughter was there for virginity verification because she was to be engaged and subsequently married off that month, and appointments in my hospital's OPD are a bitch to get, and they needed to present that certificate along with some others, regarding finances, genealogy, and a few others, to the prospective groom during the engagement ceremony. I went completely numb, detached, examined the poor girl silently. She was in the stirrups and naked from the waist down and burqa above that, not even an eye slit, and discovered, for the first time, a stack of thick, extremely official-looking certificates in a desk drawer, to be given to women who passed the examination. I have since performed that examination close to 30 times, and have seen quite a few females who didn't have an intact hymen, and actually sobbed quietly in shame during the examination. I try to explain to the family that hymen rupture is in no way a sign of promiscuity or even sexual penetration. To those people I know wouldn't understand, I just certify their daughter's virginities and tell the girl to come up with an excuse later on to their families. Damn, someone tells on me and I'm gonna be facing one hell of a malpractice suit. Story 13. Not me, but a fellow classmate in medical school. We have mock exams, and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that pretty standard stuff, grabbed a tongue depressor and had her open her mouth. Then, nothing, he did it again, and said with bewilderment, "That is weird, you do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. Story 14. I was the chaperoning nurse, young doc, first week in OB and was seeing a early pregnancy point in triage. Docs usually say, "I'm going to put my hand on your vagina now," or, "You will feel the speculum on your lips/labia." He was rattled and so nervous he conflagrated them as, "I'm going to put my lips on your vagina now." The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. Story 15. General Surgeon, 31/F, for context, I work for a county hospital taking care of very salt-of-the-earth patients. These are my people, as I was also born with a plastic spork in my mouth. Talking one morning to a young man who was about to get his inguinal hernia fixed, and his only question to me was, "When can I have sex again?" The only person with him was his girlfriend, who was smoking hot, so I broke him the bad news: "You're gonna wake up feeling like a horse kicked you right square in the junk. So, go ahead and do what you want when you feel like you want to, but it's not gonna be today." We get him to the OR, put him under general anesthesia, and then a very new, very young, very pretty female nurse starts to prep him. To those unfamiliar, this involves vigorously scrubbing down the groin, including the penis and scrotum, with what amounts to a sponge on a hollow stick that dispenses a compound that decontaminates the skin somewhat. As soon as she starts scrubbing, the patient pops a raging boner. He's completely under and paralyzed, mind you, but the more she cleans, the bigger it gets, and yeah, this kid's a shower, I tell you what. Poor thing, her face just gets redder and redder, and it gets bigger and bigger, and everyone's giving her shit the whole time. I finally stop her because I'm afraid any second he's gonna break scrub and contaminate my field. O_0. We do our best to drape around old Ron Jeremy. It was hard. My poor, married with kids and straight as far as I know, male resident had to keep batting the damn thing out of our field during the whole case. Afterwards, I made sure to reiterate to the hot girlfriend that he probably wouldn't feel like having sex in the near future. She asked me point blank if it was okay if she blew him, and I told her to go nuts. He asked me the same question when he woke up from anesthesia, and when I gave him the same answer, he gave me a knuckle bump in reply. God, I love county folk. Story 16. Used liquid nitrogen to freeze genital warts off of a 20-something-year-old girl. After she touched her genital warts with her hands to show me where they were, I applied cryotherapy and left the room for a moment so she could get dressed. When I got back, she proceeded to grab my hand and shake it. After touching all of her warts. Without washing her hands. Story 17. Patient here. I was in a small town where my parents used to live and I had to see a gynecologist. I was worried that I may have had a tampon stuck in my vagina. PSA, that's not physically possible, but I didn't know that at the time. Unfortunately, the only doctor I could see was a friend of my parents. After thoroughly probing and peeking, he informed me that there was nothing wrong. In fact, your vagina is, for lack of a better word, gorgeous. I've never been so embarrassed. I had to babysit his kids that weekend. Story 18. My pediatrician used to substitute this old male doctor sometimes without notifying anyone. It was almost always the days I was coming in for my sports physical. That feel when you're going to get your balls touched by a lady doctor in your early teens and then seeing an old man snapping latex gloves on. Story 19. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolar mania, she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd fuck your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0/10. She's the only patient who made me question my heterosexuality. Story 20. Somewhat related, but from a patient's perspective. When I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold, it was an incredibly attractive med student from my school who I bumped into all the time, and he saw the inside of my vagina. I never could look him in the eye after that. Story 21. After receiving an internal exam from my GYN, he asked if he could bring a medical student in so they could get some practice. I agreed, thinking he meant student. He took a good 10 minutes, but after that, in walked a group of about 5 people, male and female. They each took turns putting their fingers in my vagina, then talking about me like I wasn't there as they reported what they felt to my GYN, syphilitic chancre? Cystocele? With his back turned to me, my GYN corrected them and told them exactly what they had been feeling. It's her penis, attached to the interior wall below the cervix. Her urethra is inside her vagina. She was born with ambiguous genitalia and had cosmetic feminization at 2 years of age, but the surgeon missed the internal structures. Story 22. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mom thought something was wrong with me. So she took me to the doctor, and he wanted to check for testicular cancer. I had a worried look on my face because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up your balls." I felt pretty awkward after that. Story 23. I'm not a doctor, but I'm a nurse that mostly deals with wounds. I had a patient once who had suffered from NSFL, Fournier gangrene. NSFL. He had already been through surgery and reconstruction with skin grafts to the whole area, and I was seeing him twice daily to redress some residual, but substantial open areas around his penis, down the sides of his groin and thigh, up his abdomen, and on his scrotum. TLDR, the guy's dick and balls had recently rotted away, been skint down, and then had donor skin from his thighs stapled on. At any rate, as I'm scrubbing away, my face about a foot away from his painfully swollen and misshapen bits, he becomes erect. I didn't even notice because his edema was so bad. It didn't even occur to me that it would happen, because I was scrubbing the open areas, and jamming tips under his foreskin. He moaned. I asked if he was in pain. He usually was, and he goes, well, no. It's just different. That didn't even clue me in. The wife had to mention something. Uneasy face. Story 24. I will preface by saying that the word opposite doesn't quite fit here. Last year I had a transgender patient, FTM, who had completed their transition, hormones and mastectomy only, for now, and had been living as a man for about a year or so. One day he called me and asked if he could have a blood test for HPV. I told him that the only test for HPV was a cervical swab. To be thorough, since he still had a uterus, we could do a pap smear with a swab to check for HPV. He agreed. It was a difficult and painful exam. He'd never borne children while a woman, and the testosterone he was taking made his vaginal canal smaller/drier. Even with the smallest sized speculum, it was very uncomfortable for him to complete the exam. It was awkward for me, not just because of his pain, but because he had been content with his transition and was living happily as a man, and then I had to give him an intrusive, painful reminder that he used to be a woman. It felt like a violation to me, much more so than the usual pap/rectal exam, like I was somehow going against the transition he'd worked so hard for. Of course, to top it all off, the lab lost the HPV sample. We'll have to repeat it again sometime this year. Thankfully, at least he has an amazing attitude despite this. I still feel awful about the whole thing. Story 25. Kind of unrelated, but one time my uncle was in the hospital for a few days, and he had to give them a urine sample each morning. The last day, however, he was told by a nurse that he didn't need one. So he filled up the cup with apple juice and waited for his doctor. The doctor came in and saw the cup and told him he didn't need to pee in the cup that day. My uncle just shrugged and drank the cup. The doctor stood there speechless until my uncle and the nurse next to him burst out laughing.